Hi, I'm Dr. Kiran Iqbal. I'm the medical director at the Wellness Connection and a board certified child, adolescent, and adult psychiatrist. Sometimes, parents come up to me and they want to know when is the right time to start their child or their family member on a medication. And generally, I would say that when you feel like the behavioral modifications, therapy, giving the child structure, everything else that you've thought of and talked about with your child, your therapist, your pediatrician, and all these modalities have worked, but not quite as well as you would like them to, and your child or teenager is still having problems at school, at home, I think that's about time where that's something that you might want to think about, something that you might want to consider. Can medication in this situation help? Can it take that edge off where the teenager or the child can then start performing at their baseline functioning? I also don't want the family members and the caregivers to feel like their child has to be on medication for years or for the rest of their life. Generally, what I recommend is if a child has a good school year, one good school year, I'll try to talk to them about maybe coming down on the medication, possibly coming off of the medication during the summer, because that's a less stressful time of the year. There's not a lot of school that can be disrupted with the taper off of the medication. And then there's always that element of, are there times when somebody, a child or an adult, should not be on a medication, and they are in fact taking a medication that may or may not be helping them. I generally recommend that whenever there's an acute stressor or a life-changing event, or if a trauma or something that triggered certain behaviors that keep on escalating after a certain traumatic event occurs, during that situation, sometimes medication might not be the answer. Sometimes seeing a therapist only and being with your family in a supportive, nurturing environment and being able to talk about the stressor or the trigger is probably the best thing to do. And medication might not necessarily be the answer for adjustment issues or certain issues that started after a traumatic event, because in those situations, talking about the stressor, talking about the trauma, talking about the event is what will eventually help you go back to your baseline. Some of the disorders that medication works great for are ADHD, as well as anxiety disorders, depression, bipolar, postpartum depression, psychosis, schizophrenia. Some of these disorders respond really well to medication management, of course, with the help of individual therapy and the other support system in place. And if you have any further questions or concerns, or if you would like to know if your child, adolescent is someone that can benefit from medication, you're always welcome to come and see me at the Wellness Connection. Seeing a psychiatrist doesn't always necessarily mean starting a medication, but sometimes just diagnosis clarification and other treatment options can also be discussed during the appointment, and we can always defer the starting of a medication to further or future appointments. Thank you so much. My name is Dr. Kiran Iqbal, and I'm the Medical Director at the Wellness Connection.